Hello friends, good evening. Welcome to NEET PG Live Daily. Myself, Dr. Apoorva Mittal, and I'll be taking your anesthesia lectures on this prestigious platform of Unacademy, which is India's leading online classes for all the courses. And in NEET PG subscription, Unacademy subscription, we can have access to live classes for all the 19 subjects, and we can interact with top educators of India. Regularly, we'll be having test series and analysis, and to get more environment like a live doubt clearing sessions are also available. So, after getting an academy subscription, we can apply for either 12 months or 24 months course in which we'll be able to access the live classes and mock test and analysis, and also the doubt clearing sessions. And if you apply my code, that is APOORVA live, on the above prices you can get 10% discount. So friends, let's start our today's lecture, that is monitoring in anesthesia. Today we'll discuss mainly on the pulse oximetry and temperature monitoring. So all of us would have seen this monitor in our UG or internship period in the OT. Now, what does this monitor tell us about, and why is it very important for an anesthesiologist? When the patient is under the influence of anesthesia, especially general anesthesia, anesthesiologist cannot communicate with the patient. So, to know the physiological parameters or what is going physiologically in the patient can be known by this monitor. For example, if there is increase in the heart rate or if there is increase in the BP, we can suspect that the patient is having pain, so we can increase the dose of anesthesia. So through this monitor, we are able to communicate with the patient. Okay, so the monitor is the one through which the anesthesiologist can communicate with the patient. So why is monitoring necessary? Monitoring is continuous or nearly, sorry, 1 second. Yeah. So why is monitoring necessary? What is it? It is a continuous or nearly continuous evaluation of physiologic function of patient in real time. So in this we can continuously evaluate the physiologic function of patient in real time when he or she is under anesthesia. And this will help us to guide management decisions, including when to make interventions and when the interventions are made, to assess those interventions. Okay, that will help us to assess the patient's safety and also to see the patient response to clinical interventions. Okay, now according to ASA, which is American Society of Anesthesiologists, there are standard monitors. So what are these standard monitors? These are the monitors which are considered a minimum, okay, during all general, regional and monitored anesthesia care. And these monitors can be exceeded at any time as deemed necessary. Like if we think that on these standard monitors, if we need cardiac monitoring specifically, we can add those monitors like invasive BP or pulmonary artery catheterization monitoring. So but these are the monitors which should be at least present for all the patients who are requiring general, regional or monitored anesthesia care. So what are these standard monitors? These are asked in question in the NEET exams. So first, most important thing is we have to assess the oxygenation of the patient. So how can we assess it? So by the physical signs, we can see the color of the skin and mucous membrane. Like if we suspect that the skin color is bluish in nature. That means there is some problem with oxygenation. So that is one of the physical signs. And in monitor, the most important is pulse oximeter. Through pulse oximeter, we can know about the oxygen saturation of the patient and also the inhaled oxygen concentration. Then ventilation. Ventilation, the physical signs in ventilation is by looking at the chest excursion, like if the chest is rising properly or not, we can know if the patient is being ventilated properly or not. If the chest rise is not proper, that means there is some problem in ventilation. So for anesthesiologists, the physical signs are as important as those the ones which are seen in the monitor. So anesthesiologist should be very vigilant. He or she should not just depend upon the monitor. So for ventilation, what two parameters we'll see? The breath sounds. Okay, if the breath sounds are correct or not, and secondly the chest excursion. On monitoring for ventilation, preferably we should use end-tidal CO2 analysis. Okay, for circulation. Now for circulation, we have to see the pulse and BP and heart sounds. So on physical signs, the pulse palpation. Through palpating pulse, we can know if the pulse is regular or not, if the volume of the pulse is regular or not. So through this, we can diagnose various diseases. And auscultation of the heart sounds, if there is any murmurs or any added sounds. Okay, so in this circulation, we can know this. Monitor, important is the ECG to know the rate, rhythm, and also any abnormalities. BP, that is non-invasive BP, and the heart rate. Okay, and most important, temperature monitoring. Temperature monitoring is also very important in physical science, which we can touch the skin and tell if it is a cold and clammy skin. We can think that the patient is in shock. Okay, and to monitor, we can use the temperature probe. So, according to the ASA, the standard monitors which are for anesthesia are for oxygenation, pulse oximetry, for circulation, ECG, BP, heart rate, and for temperature, the temperature probe. For ventilation, the EtCO2 monitoring is preferable. Okay, now these were the standard monitors. Now, according to the procedure, the other parameters which can be monitored are the depth of anesthesia. Okay, if what anesthesia we have given, okay, is it adequate for that patient or not? Okay, how can we know that the patient is awake or not? So that is through the depth of anesthesia. Now the muscle relaxants which we are given, which we give, if those are enough or not. So through for that we have to do the neuromuscular block monitoring. Okay, and this transesophageal echocardiography, this is also a very important parameter. It is more sensitive to know the intraoperative MI or intraoperative this pulmonary embolism. So these all we will discuss in other lectures. Today we'll focus mainly on the pulse oximetry, which is a standard monitor for oxygenation and temperature monitoring. So friends, coming to, I hope till now it was clear. So today the most important point is the pulse oximeter. Okay, what is pulse oximeter and why is it so important? All of us would have seen this pulse oximeter. Okay, the advantages of this pulse oximeter, the uses of this pulse oximeter. Okay, the advantages, uses, what does it tell us about? Okay, that we'll discuss here. Okay, so first, What it is a non-invasive technique to monitor the oxygen saturation of hemoglobin. This is very important. It is telling us only about the oxygen saturation of hemoglobin. Okay, so like in this we are saying SpO2, that means how much oxygen is bound to hemoglobin, that is 97%. It also tells us the rate. So why is it so useful? Because as we can see, it is a very small device, so it is compact. Okay, it is relatively cheap. Okay, and before the eyes can diagnose that there is bluish discoloration or cyanosis, before that this pulse oximeter can pick up the fall in oxygen saturation. Now we would have seen that during this COVID time, everyone is telling that to monitor the oxygen saturation or to monitor the patient's well-being, please use pulse oximeter. Why is it so? Because the COVID, it is affecting mainly the respiratory system, which causes a sudden drop in SpO2. So even if the patient is asymptomatic or is mildly symptomatic with fever or dry cough, he or she might experience happy hypoxia or silent hypoxia. Now, what is happy or silent hypoxia? See, in COVID patients, why pulse oximeter monitoring is very important is, in first we'll talk about the normal patients. Normal patients, if the saturation it falls below 90%, the patient becomes breathless. Okay, there is hunger, oxygen hunger is there. Okay, but in COVID patients, even when the SpO2 falls less than 90%, the patient does not become breathless. Okay, no breathlessness is there. And then there will be sudden deterioration of the patient condition. So to prevent that, we should use the pulse oximeter regularly in case of the COVID patients. Now, as discussed earlier, what does it tell us about? It tells us about the oxygen saturation of hemoglobin. Now, what it is actually? Okay, this is very important point. See, the oxygen in body, okay, it is carried in two forms. Okay, one is the dissolved form and the other is bound to hemoglobin. Okay, dissolved form is only 3%, bound form is 97% of the oxygen which is carried is through binding to the hemoglobin. Okay, so the pulse oximeter, it tells us about how much hemoglobin is saturated with oxygen. Okay, how much hemoglobin is saturated with oxygen. For example, अब एक ही मॉलिक्यूल ऑफ हीमोग्लोबिन है, ठीक है, जैसे ये 5 बना दिए, ठीक है. If all of them have oxygen bound with it, that means our saturation is 100%. Okay, but if only 2.5 or 2 hemoglobins are bound to oxygen, that means the saturation will be 50%. So it tells us about the SpO2, that is how much hemoglobin is saturated with oxygen. The second thing it tells us is the pulse rate. Okay, as we saw in that picture, in that SpO2 and pulse rate was seen. Thirdly, very important is, it also tells us about the tissue perfusion. Now, how does it tell us if the tissue perfusion is okay or not? That is through the plethysmograph. Okay, there is a graph which appears on the side of this reading. So that is known as plethysmograph. The amplitude of this plethysmograph will tell us about the tissue perfusion. Okay. What is the principle behind it? How does it tell? I'll discuss it later in this lecture. And fourth, it tells us about perfusion index. What is perfusion index and what's its importance? Let's see that. So in this slide, the most important point which is asked is, what does pulse oximetry tells us? It tells us about how much hemoglobin is saturated with oxygen. It does not tell us about the dissolved oxygen. It does not tell us about the total oxygen content. Okay, it will tell us only about how much hemoglobin is saturated with oxygen. Now coming to the point, what is perfusion index? Now perfusion index is ratio of pulsatile blood flow, okay, to the non-pulsatile blood flow or static blood in peripheral tissue. So the ratio of the pulsatile blood flow to non-pulsatile blood flow will tell us about the perfusion index. Now why this perfusion index is important? For example, whenever we are giving regional anesthesia, जैसे if for example अगर हमने spinal anesthesia दिया है, how do we know that the effect has come or not? In adults, we can ask to lift their leg, or if we can ask that if they are experiencing any tingling sensation or not. And if they are not able to lift their leg, that means our effect has come. Okay, but in case of the children, infants or children in which we are giving caudal anesthesia, they cannot communicate with us and we can't ask them to lift their leg and we can't assess if the effect has come or not. In that case, we'll see the perfusion index. Okay, because of the caudal anesthesia, there is vasodilation in the lower limbs. Okay, so if we will apply the pulse oximetry in the greater toe, we'll see that the perfusion index has increased. Okay, and that means our effect has come. This is one of the example and one of the uses of perfusion index. So the changes in perfusion index can occur as a result of vasoconstriction. तो vasoconstriction कम होगा तो वहाँ पे perfusion कम होगा, so the pulsatile blood flow will be less, है ना, as compared to non-pulsatile blood flow, the ratio will decrease. That means there is vasoconstriction. जबकि whenever there is vasodilation, the pulsatile blood flow will be more to that area and therefore there will be high perfusion index. Are you getting my point? So in this, as discussed, there will be SpO2, pulse rate, tissue perfusion and perfusion index. Okay. Now, what is the principle, okay, on which our pulse oximeter depends on? So the principle on which the pulse oximeter depends on, that we have to see. Okay, so it is based on two principles, that is spectrophotometry. Okay, now what is spectrophotometry? Spectro, this is the spectrum of light. Okay, so what does pulse oximeter do is, okay, in this there is absorption of light at two different wavelength, okay, two different wavelength by hemoglobin. It depends on the degree of oxygenation of hemoglobin. अब इसका मतलब क्या है? Let's see it with a diagram. ये finger है, okay, इसके अगेंस्ट मैंने यहाँ पे एक पल्स ऑक्सीमीटर लगा दिया, ठीक है. Now there is a light emitting diode here, light emitting diode, okay, which is emitting light of different wavelength, which is of two wavelength, एक तो red light और एक infrared light, ठीक है। अब रेड लाइट की वेवलेंथ अराउंड 660 है और इंफ्रारेड की वेवलेंथ अराउंड 960 है, ठीक है। सो व्हेन दिस इज एमिटिंग द लाइट, ठीक है, डिपेंडिंग अपॉन व्हाट type of hemoglobin, whether oxygenation or deoxygenated hemoglobin is present, it will absorb the light, okay, and that will be detected by a that will be detected and that will be detected by a photo detector which is present here. तो इधर अगर ऑक्सीजनेटेड हीमोग्लोबिन ज्यादा है तो वो क्या करेगा, इट विल एब्जॉर्ब मोर ऑफ द इंफ्रारेड लाइट, ठीक है। तो फोटो डिटेक्टर विल डिटेक्ट क्या, कि देयर इज मोर ऑफ रेड लाइट विच इज प्रेजेंट। जैसे फॉर एग्जाम्पल, जैसे अब ये डायग्राम है, ठीक है, इन दिस डायग्राम इफ देयर इज मोर ऑफ deoxyhemoglobin, okay, what does deoxyhemoglobin does is it, deoxyhemoglobin का कलर ब्लूइश होगा, ऐसे याद रखेंगे। इसका मतलब इट विल एब्जॉर्ब मोर ऑफ रेड लाइट, ठीक है, सॉरी, absorb more red light as compared to infrared light, okay. So the photo detector, it will detect more of infrared light, ठीक है। ऐसे अगर ऑक्सीहीमोग्लोबिन है, ठीक है, तो उसका कलर क्या होता है, रेड। that means if hemoglobin is oxyhemoglobin, it will absorb more of infrared light. So absorption of two different wavelengths, red light or infrared light, by hemoglobin differs depending on the degree of oxygenation, whether oxygenated or deoxygenated of hemoglobin. So that principle is spectrophotometry. I hope that is clear, ठीक है। अब इसमें SpO2 कैसे आता है, द रेशियो ऑफ द रेड लाइट अपॉन द इंफ्रारेड लाइट, इसका जो न्यूमेरिकल ट्रांसफॉर्मेशन है दैट विल टेल अस अबाउट द SpO2, okay. So if the red light absorption is more, then SpO2 value will be less, so ratio is inversely proportional to the SpO2 finding, okay. Now the second principle is photoplethysmography, ठीक है। इसका मतलब क्या है, इसका मतलब ये है, और हाउ डज द पल्स ऑक्सीमीटर फंक्शन इज, द पल्स ऑक्स जो है इट एनालाइजेस ओनली द पल्सेटाइल आर्टीरियल ब्लड फ्लो, इग्नोरिंग द अदर टिश्यूज अराउंड द ब्लड, ओके। हाउ कैन वी अंडरस्टैंड दिस, वापस से डायग्रामेटिक, फिंगर पल्स ऑक्सीमेट्री। अब फिंगर के अंदर सिर्फ आर्टीरियल ब्लड फ्लो तो फ्लो नहीं हो रहा, ठीक है, देयर इज ऑल्सो द venous blood flow which is flowing, ठीक है, and there is also the tissue और फैट भी प्रेजेंट है, ठीक है। तो when the light emitting diode is emitting the light, all these structures will absorb the light, है ना, so that can give us the false value। मगर पल्स ऑक्सीमेट्री में क्या होता है कि इट एनालाइजेस ओनली द पल्सेटाइल ब्लड फ्लो, जैसे जब हार्ट बीट होता है, सो देयर इज सडन flow of the pulsatile blood, only that pulsatile blood will be assessed by the pulse oximetry and it will give us the SpO2 level, okay. So क्यों, क्योंकि जब pulsatile blood flow होता है it absorbs more light and therefore it must be due to the arterial blood, okay. I hope this is clear। तो एनी एब्जॉर्बेंस विच इज नॉट चेंजिंग, तो अगर और टिश्यूज या वेन्स से लाइट एब्जॉर्ब हुई है बट इट इज नॉट चेंजिंग इन एब्जॉर्प्शन, सो दैट मस्ट बी ड्यू टू नॉन पल्सेटाइल स्ट्रक्चर्स अराउंड द आर्टरी. तो पल्स प्रोब क्या करता है, द एब्जॉर्बेंस which is complete, that is through the artery, vein and nearby structures, minus the absorbance which is not changing, like absorbance of light from the vein and tissues, उसको माइनस करके हमें सिर्फ और सिर्फ इसकी वैल्यू बताता है. ठीक है, सो द सब्ट्रैक्शन ऑफ नॉन चेंजिंग पार्ट ऑफ एब्जॉर्बेंस सिग्नल्स फ्रॉम टोटल एब्जॉर्बेंस सिग्नल इज इक्वल टू चेंजिंग एब्जॉर्बेंस सिग्नल. इन शॉर्ट अगर हमें याद रखना है तो फ्लोटोपैथिस्मोग्राफी पल्स ऑक्सीमीटर, it will analyze only the pulsatile blood flow and it will ignore all other tissues around the blood. जैसे कि ये मैंने बताया कि इसमें ये पूरे सारे टिश्यूज, वेन्स, आर्टरी से ये आया हमारे पास एक ग्राफ एब्जॉर्बेंस का फ्रॉम द नॉन पल्सेटाइल टिश्यू, उसमें कुछ चेंज तो आ नहीं रहा, पल्सेटाइल फ्लो नहीं आ रहा. इन दोनों को माइनस करके ये हमें सिर्फ पल्सेटाइल के बारे में बताएगा. ठीक है, तो अब दिस इज द फोटोप्लेथिस्मोग्राफी. तो द पल्स ऑक्स इट ऑफन शोज द पल्सेटाइल चेंज इन द एब्जॉर्बेंस ऑफ द लाइट, है ना. और वो पल्सेटाइल चेंज इन द एब्जॉर्बेंस ऑफ लाइट व्हेन इट इज रिप्रेजेंटेड इन ग्राफिकल फॉर्म, दैट इज प्लेथिस्मोग्राफिक ट्रेस. तो हमने शुरू में डिस्कस किया था ना कि द पल्स ऑक्स इट इज टेलिंग अस अबाउट द ऑक्सीजन सैचुरेशन, pulse rate, tissue perfusion through the amplitude of plethysmographic trace. So this is through this principle. Okay, so because it detects only the pulsatile change in the absorbance of light, और वो जब graphical form में हम लोग represent करते हैं, that is the pulsatile trace. This is the pulsatile trace which is the plethysmographic trace. So when there is a good pulse volume, okay, the pulsatile blood flow will be good, so the plethysmographic trace will be good. But what if the patient is in shock या फिर hypotension है, तो क्या होगा? There will be decrease in pulsatile blood flow, है ना, volume of the blood flow कम होगा, तो उसकी वजह से द एम्पलीट्यूड ऑफ प्लेथिस्मोग्राफ डिक्रीजेस. ठीक है, सो इट विल टेल अस हाउ गुड द पल्सेटाइल सिग्नल इज. ओके, नाउ ये था, it was based on the two principles, so and it works on the principle of Beer-Lambert's law. ये भी नीट और एम्स में बहुत बार पूछ चुके हैं कि पल्स ऑक्सीमेट्री इट वर्क्स ऑन द प्रिंसिपल ऑफ Beer-Lambert's law. अब हाउ वी विल रिमेंबर व्हाट इज Beer-Lambert's law और इसका यूज कैसे होता है पल्स ऑक्स में, दैट विल डिस्कस. अब इसको कैसे याद रखेंगे? लैम्बर्ट, ठीक है, लंबा. ओके, तो लैम्बर्ट्स लंबा ऐसे याद रखना. इसका मतलब ये होता है, इट स्टेट्स दैट व्हेन लाइट फॉल्स ऑन होमोजेनियस substance, the intensity of transmitted light decreases as distance through the substance increases. मतलब जितना लंबा पाथ होगा, ओके, बट इट इज होमोजेनियस. एक स्ट्रक्चर है जो छोटा है, ठीक है, एक स्ट्रक्चर है जो बड़ा है, तो लंबा स्ट्रक्चर है. ठीक है, तो लंबे स्ट्रक्चर में देयर विल बी मोर एब्जॉर्बेंस ऑफ द लाइट. Okay, therefore the transmitted light will be less. Okay, इसको, so that means the amount of light which is absorbed is proportional to the length of the light path. ये एग्जाम्पल मैंने बताया है कि ये फिंगर है. अब ये देखो, ये आर्टरी है, ये छोटी है, ये लंबी मोटी है तो इसलिए लाइट को ज़्यादा पाथ ट्रैवल करने, बट द कंसंट्रेशन ऑफ द हीमोग्लोबिन इज सेम in both the areas. So in this, as the light has to travel more path, there is more absorption of the light. Okay, and therefore the transmitted light is less. Okay, so lamba and usse yaad rakhna hai, amount of light absorbed is proportional to the length of the light path. अब ऐसे ही दूसरा क्या है, बियर्ड्स लॉ. बियर्ड्स लॉ में क्या है, it states that when the light is transmitted through clear substance, ठीक है, with dissolved solute, the intensity of light decreases as concentration of solute increases. मतलब एक कोई सा clear substance है, मतलब clear substance है, उसमें कितने particles हैं, अगर कम particles हैं या फिर ज़्यादा particles हैं, ठीक है, तो जहाँ पे ज़्यादा particles हैं, the amount of light which is absorbed will be more and less amount of light will be transmitted. Whereas जहाँ पे कम particles हैं, more amount of light will be transmitted and less will be absorbed. Okay, so that is Beer's law. यही हो गया कि ये एक फिंगर है, आर्टरी है, सेम लेंथ की है, मगर इसमें हीमोग्लोबिन कंसंट्रेशन कम है, इसमें ज़्यादा है. So when there is low hemoglobin concentration, there is low absorption of light. High hemoglobin concentration will be high absorption of light. ठीक है, तो हम लोगों को प्रिंसिपल्स भी पता चल गए. ठीक है, फर्स्ट प्रिंसिपल क्या था, दैट वाज द स्पेक्ट्रोफोटोमेट्री, दैट इज द स्पेक्ट्रम ऑफ द लाइट, दो वेवलेंथ, रेड लाइट, इंफ्रारेड लाइट. दूसरा प्रिंसिपल फोटोप्लेथिस्मोग्राफी, कि वो सिर्फ पल्सेटल आर्टीरियल ब्लड फ्लो को मॉनिटर करेगा, उसकी वजह से प्लेथिस्मोग्राफ, उसका एम्पलीट्यूड, और लास्टली बियर्ड लैम्बर्ट्स लॉ है. ठीक है, सो दिस वाज अकॉर्डिंग टू प्रिंसिपल. हाउ डज इट वर्क? अब व्हाट आर द यूजेस? अब हमने देखा उसका प्रिंसिपल क्या है, क्या क्या बताते हैं, तो यूजेस क्या होगा? पहले मॉनिटरिंग द ऑक्सीजनेशन, ऑक्सीजनेशन ठीक है कि नहीं है, और हमने अगर किसी पेशेंट का ऑक्सीजनेशन ठीक नहीं था, कम था, और उसको ऑक्सीजन थेरेपी दी है, तो क्या वो यूजफुल है, हुई कि नहीं, पेशेंट का ऑक्सीजनेशन इम्प्रूव हुआ कि नहीं. सो मॉनिटरिंग ऑक्सीजन थेरेपी. असेसमेंट ऑफ परफ्यूजन बताया था मैंने प्लेथिस्मोग्राफ से, एंड monitoring of the vascular volume, उसी से plethysmograph से. So these are the uses of pulse oximetry. Okay, now there are some sources of error which can hamper the pulse oximetry readings. So what are those sources of errors? That is, एक है reduction in arterial pulsation. जैसे if patient is hypothermic या फिर हाइपोटेंशन या फिर वेसोप्रेसिस में है, तो ये मैंने बताया था, वहाँ पे टिश्यू परफ्यूजन अच्छा नहीं होगा, आर्टेरियल पल्सेशन कम होगा. तो इसमें क्या होगा, इट इज डिटेक्टिंग ओनली द पल्सेटाइल फॉर्म, तो इसमें प्लेथिस्मोग्राफ का एम्पलीट्यूड कम आ जाएगा, एंड दैट विल हैम्पर आवर SpO2 रीडिंग. ओके, बॉडी मूवमेंट्स, if the patient is shivering या फिर उसको पार्किंसोनिज्म है, that will also give us false value of SpO2, because वो लाइन में नहीं रहेगा, बार बार हिलेगा, तो it will give us the false value. Okay, then deoxyhemoglobinemia. ठीक है, this is very important कि pulse oximetry deoxyhemoglobinemia में कैसे false value देता है. See, कार्बोक्सी हीमोग्लोबिन, एक तो इसका मतलब हाउ मच कार्बन मोनोऑक्साइड इज बाउंड टू हीमोग्लोबिन. अब हमें पता है कि द एफिनिटी फॉर कार्बन मोनोऑक्साइड इज 20 times more for hemoglobin than as compared to the oxygen affinity for hemoglobin, है ना. मगर जो कार्बोक्सी हीमोग्लोबिन है, उसका द एब्जॉर्बेंस of wavelength of light is identical to ऑक्सीहीमोग्लोबिन। मतलब हमने देखा था कि ऑक्सीहीमोग्लोबिन किसको ज्यादा एब्जॉर्ब कर रहा था, इंफ्रारेड वाली वेवलेंथ को। कार्बोक्सी हीमोग्लोबिन भी इंफ्रारेड वाली वेवलेंथ को ज्यादा एब्जॉर्ब करता है, देयरफॉर इट गिव्स फॉल्सली हाई वैल्यू। ठीक है, ऐसे मेथ हीमोग्लोबिन में क्या होता है, मेथ हीमोग्लोबिन में द एब्जॉर्बेंस ऑफ red and infrared light is 1:1। तो ये हमें SpO2 की रीडिंग 85 दिखाते हैं। ठीक है, तो अगर एक्चुअल में हमारा SpO2 या फिर ऑक्सीजन सैचुरेशन जो है वो 80% है, तो इट इज शोइंग अस फॉल्सली हाई। ठीक है, और अगर एक्चुअल में हमारा जो सैचुरेशन है दैट इज 90%, बट बिकॉज ऑफ मेथ हीमोग्लोबिनेमिया इट इज शोइंग अस फॉल्सली लो लेवल ऑफ सैचुरेशन। ठीक है, तो कार्बोक्सी हीमोग्लोबिन फॉल्सली हाई वैल्यू। ठीक है, व्हाई, बिकॉज द एब्जॉर्बेंस ऑफ वेवलेंथ ऑफ लाइट इज आइडेंटिकल टू ऑक्सी हीमोग्लोबिन। ठीक है, अब ये भी कलर इंटरफेरेंस हम लोगों ने काफी बार देखा होगा। फीमेल पेशेंट्स ओटी के वक्त दे हैव पुट मेहंदी ऑन देयर नेल्स, ठीक है, या फिर दे हैव पुट नेल पॉलिश, दैट हैम्पर्स द SpO2 रीडिंग। तो इसलिए अगर नेल पॉलिश है वी ट्राई टू रिमूव इट बिफोर मॉनिटरिंग द SpO2 लेवल। व्हाई इज इट, बिकॉज द ओपेक नेचर जो वो नेल पेंट है इट हैम्पर्स विद आवर रीडिंग। स्पेशली इसमें क्या है कलर इंटरफेरेंस, स्पेशली if it is blue or violet color nail polish, it hampers with the SpO2 reading. Now physical factors, if the surgeon is using electrocautery तो उससे जो electrical waves निकल रही है that hampers with the SpO2 reading. और ब्लड प्रेशर कफ इन सेम आर्म, इससे क्या होगा, सेम आर्म में ब्लड प्रेशर है तो जब वो बीपी की रीडिंग ले रहा है, जब वो इन्फ्लेट हो रहा है, ठीक है, तो क्या होगा, द ब्लड सप्लाई टू दैट पर्टिकुलर आर्टरी, मतलब जैसे रेडियल आर्टरी कम हो जाती है तो पल्सेटाइल लेवल कम हो जाएगा और हमारी SpO2 की रीडिंग कम आएगी, विच इज फॉल्स। Okay, so I hope this is clear. This was the sources of error. Now, that was all about the pulse ox. Okay, so the pulse ox, it is telling us about the oxygen saturation of the hemoglobin. We discussed about the various principles, uses and sources of error. Now coming to the second topic for today, that is temperature monitoring. Now why temperature monitoring is important? Okay, and what if the patient is hypothermic? Why the OT temperature is kept on a lower side, and what are the various sites in which the temperature monitoring is done? We'll discuss in this topic. So how is it done? It is done with the help of the thermistors या फिर thermocouples. And the core body temperature, it is always more than the rectal temperature, more than the surface temperature. ठीक है, so when we are defining hypothermia, we are telling it in terms of the, in relation of the core body temperature. So if the core body temperature is less than 35 degrees Celsius, that means the patient is hypothermic. So this hyperthermia is in relation to the core body temperature and not according to the rectal or the surface temperature. Okay, अब नॉर्मली हम लोग ओटी का टेम्परेचर देखा होगा, ओटी में ज़्यादातर थोड़ी ठंडा रहता है। सो नॉर्मली द ओटी टेम्परेचर इज 26 to 28 डिग्री सेल्सियस, दैट इज हाइपोथर्मिक एनवायरमेंट। फर्स्ट ऑफ ऑल, जब हमें पता है कि हाइपोथर्मिया होने के चांसेस हैं पेशेंट को, व्हाई वी आर कीपिंग द ओटी टेम्परेचर टुवर्ड्स द लोअर साइड? कुछ तो रीजन होगा. सो दैट इज बिकॉज एक तो लो टेम्परेचर पे देर आर लेस चांसेस ऑफ इन्फेक्शन. ठीक है. फिर और लो टेम्परेचर होगा, ब्लड वेसल्स थोड़ी सी वेसो कंस्ट्रिक्ट होंगी, तो उसकी वजह से ब्लड लॉस कंपैरेटिवली कम होगा. ये मैं ओटी टेम्परेचर की बात कर रही हूँ. ठीक है. एंड देन अब ओटी टेम्परेचर कम होगा. ठीक है. तो कम टेम्परेचर में क्या होता है, मेटाबॉलिज्म कम होता है. उसकी वजह से क्या होगा, CO2 प्रोडक्शन कम होगा. CO2 क्या करता है, इट वेसोडाइलेट्स द वेसल. है ना. CO2 causes vasodilation. So less CO2, less vessels are vasodilated. स्पेशली इन न्यूरो केसेस हम लोग टेम्परेचर को, ओटी का टेम्परेचर अराउंड 28 डिग्री सेल्सियस रखते हैं. क्यों? अगर CO2 की वजह से इंट्राक्रेनियल वेसल्स वेसोडाइलेट हो जाएंगी तो ICP रेज होगा. तो बिकॉज ऑफ डिक्रीज इन वेसोडाइलेशन देर इज लेस रेज इन द ICP. ठीक है. ICP does not raise and therefore there won't be brain swelling. Understood? So these are the advantages of the hypothermic atmosphere. But that does not mean that our core body temperature should also decrease. Okay. तो अब OT के अंदर, ठीक है, अब सर्जरी में हीट लॉस हो रहा है. ठीक है. General anesthesia, regional anesthesia, anyways, because of the depression in the thermoregulatory part, there is loss of heat from the body. So how is heat lost? That is because of the radiation. सबसे ज़्यादा, more than convection, more than conduction. Now what is radiation? इसके ऊपर भी क्वेश्चन आता है. Radiation, convection and conduction, what are these? एंड दूसरा क्वेश्चन क्या पूछा जाता है, द मैक्सिमम हीट लॉस इज फ्रॉम इन द फॉलोइंग ऑर्डर. सो इट इज रेडिएशन, कन्वेक्शन, रेडिएशन, इवेपोरेशन, कन्वेक्शन एंड कंडक्शन. ओके. तो हाउ इज द हीट लॉस थ्रू रेडिएशन? ओके. दैट इज सबसे ज्यादा, दैट इज अराउंड 60%. सो सी द बॉडी, इट इज रेडिएटिंग द इंफ्रारेड रेज. ठीक है. तो अगर सराउंडिंग टेम्परेचर लेस है देन द बॉडी विल लूज द हीट टू द सराउंडिंग एरिया. सो दैट इज, it is losing the heat by emitting the infrared rays and that is radiation. Okay. Evaporation, evaporation में moist area से dry area में जाएगा, that will cause heat loss, that is 22%. So radiation then evaporation. What is convection? Convection, the air currents, जैसे बॉडी के अराउंड के जो एयर currents हैं, if they are cold, that will also cause the heat loss. So that is through the convection. Conduction, बॉडी किसके कांटेक्ट में है? ठीक है. डायरेक्ट किसके कांटेक्ट में, जैसे OT टेबल है. ठीक है. If it is cold, so the loss of heat is because of the conduction. ठीक है. तो सबसे ज्यादा किससे हो रही है? रेडिएशन से. एंड व्हाट इज इट? इंफ्रारेड रे से, इवेपोरेशन से, कन्वेक्शन, दैट इज थ्रू द एयर करंट्स व्हिच आर सराउंडिंग द एरिया, एंड देन द कंडक्शन, दैट इज द बॉडी with what it is in direct contact. So these are the mechanisms of the heat loss from the body. So as discussed, radiation is heat loss by means of the electromagnetic waves, that is the infrared rays. Convection, air currents, loss to medium in which the body is lying due to the bulk movement. Okay. Conduction, loss of close contact with objects of the lower temperature. Okay. तो ये तो mechanism है by which the body is trying to lose heat. So we should take some preventive measures to prevent the heat loss from the body. So what are those? So how can we prevent the heat loss? Okay, first, conduction. Okay, conduction क्या था? When the body with what it is in direct contact. So we can prevent this by maintaining or warming the OT temperature and use of the warming mattresses. Convection, रूम हीटर यूज करेंगे तो जो एयर करंट है वो वार्म होगा, therefore there will be less loss of the body heat. And if the infant is there, cover the infant with cotton roll or warming blanket. Evaporation से कैसे? Humidification of the inspired gases हम लोग करते हैं, या फिर जब बहुत ज़्यादा ठंड होती है तो रूम टेम्परेचर से जो एनवायरमेंटल टेम्परेचर है उससे अपने आईवी फ्लूइड्स भी बहुत ठंडे हो जाते हैं. दोज आईवी फ्लूइड्स वी शुड नॉट इन्फ्यूज. ओके, उसमें हम लोगों को पहले उसको बॉडी टेम्परेचर तक तो वार्मिंग द आईवी फ्लूइड्स, दिस इज वेरी इंपॉर्टेंट, हम लोग करते भी हैं. ठीक है, वार्मिंग स्किन डिसइंफेक्टेंट सॉल्यूशन एंड यूजिंग द वार्मिंग ब्लैंकेट्स. रेडिएशन इंक्यूबेटर को यूज करने से. ठीक है, नाउ अडल्ट्स में हाइपोथर्मिया होने के चांसेस कम है as compared to infant. In infant we have to take various steps and we have to be very we have to take precautions because they are very vulnerable to hypothermia. Why is it so? Because infants have large ratio of body surface to the weight. ठीक है, उनका जो body surface area है that is more than as compared to the weight, so more amount of heat loss is there. Thermoregulation उनमें ठीक से develop नहीं हुआ होता है. There is poor thermoregulation and the layer of fat and skin is very thin, so insulation is also poor. Okay, now अगर पेशेंट हाइपोथर्मिक हो गया, वाई वी आर सो लाइक कि वी हैव टू डू द टेम्परेचर मॉनिटरिंग एंड इट इज द मिनिमम मॉनिटरिंग विच शुड बी डन अकॉर्डिंग टू द ASA. वाई इज इट सो? क्योंकि अगर पेशेंट हाइपोथर्मिक हुआ तो क्या होगा? एज डिस्कस्ड, मेटाबॉलिज्म विल बी लेस, CO2 विल बी लेस. ठीक है, अगर CO2 कम होगा तो respiratory stimulation will be less and therefore there will be respiratory depression. ठीक है, CO2 कम होगा, एसिडोसिस कम होगा, एसिडोसिस होने के ज़्यादा चांसेस हैं. मेटाबॉलिज्म कम होगा तो उसकी वजह से इंक्रीज ड्यूरेशन ऑफ ड्रग होगा, है ना. एंड कोगुलोपैथी, इसको तो हम लीथल ट्रायड, वी ऑल नो, हाइपोथर्मिया. ठीक है, ऐसे लीड्स टू एसिडोसिस, कोगुलोपैथी. ठीक है, so there are more chances of bleeding because the platelet function will be hampered. Okay, so this is about the temperature monitoring. Now what are the sites at which the temperature monitoring should be done? These 4 questions or points have been asked numerous times in NEET and AIIMS PGs. Okay, so सबसे पहले कोर बॉडी टेम्परेचर पे अगर आए, ठीक है, तो बेस्ट साइट अगर पूछा जाए, सो दैट इज पल्मोनरी आर्टरी. ओके, सो बेस्ट साइट टू मेजर द कोर बॉडी टेम्परेचर दैट इज पल्मोनरी आर्टरी. मगर पल्मोनरी आर्टरी में हम लोगों को थर्मिस्टर या फिर थर्मोकपल डालना पड़ेगा बाय पल्मोनरी कैथेटर, विच इज टीडियस और हर पेशेंट में पॉसिबल नहीं है. तो बेस्ट साइट इज दिस, मगर मोस्ट कॉमनली यूज जो होता है फॉर कोर बॉडी टेम्परेचर दैट इज लोअर एंड ऑफ द ईसोफेगस. Okay, so best is pulmonary artery, most commonly used is lower end of the esophagus. This is about the core body temperature. Brain temperature, ठीक है, most accurate site अगर पूछा जाए that is the tympanic membrane, मगर अगर best area पूछा जाए तो that is nasopharynx. Okay, so this is about the sites at which best and most commonly core body temperature or the brain monitoring, brain temperature monitoring is done. Okay, so that was for today's class. And for the Unacademy subscription, you can download the Telegram app and then go to the channel, that is livedaily.me or NEET PG, and get the Unacademy subscription. For Unacademy subscription, these are the following steps: Unacademy learning app, which you have to install, and then you can select the NEET PG plus, okay, or a subscription. And as I told earlier, after getting the subscription for Unacademy, you will be able to assess the live classes for all the 19 subjects, or top educators से you can have classes, and mock test analysis और doubt उसी वक्त live classes में उसी वक्त doubt clear हो जाएगा, which is same as a live classroom. Okay, and this the subscription you can take either for the 12 months or 24 months for all the 19 subjects. The advantage of taking either a 1 year or a 2 year courses, जैसे you'll be able to assess the live classes and the mock test throughout the year, तो बार बार revision भी होता जाएगा, ठीक है. And if you apply my code, that is APOORVA live, you can get 10% discount on these prices. And please on YouTube subscribe NEET PG and subscribe it, and click the bell icon, like and share, and use my referral code, that is Apoorva Live, and get 10% discount on your Unacademy subscription. So friends, that was all today for the class, which was the first part of anesthesia monitoring. So today we discussed a very important topic, that was pulse oximetry and temperature monitoring. Tomorrow we'll discuss about another important topic, that is on capnography, from which many questions have been asked. So let's see you tomorrow. Thank you for today.